Hello, I'm Elizabeth Makous, the Pelvic Whisperer. As a physical therapist who has had the honor and privilege of treating the pelvic floors of men and women for over 25 years, I am always on a quest to find better and easier ways to release tight muscles and fascia. And on my quest, I discovered some really cool ways to use the pelvic therapy TheraWands. So on our journey today, I hope that you will also sort of figure out which TheraWand is the best for your body's needs. First, I would like to review the use of each TheraWand, how they're intended to be used, and then my kind of cool extra ways to use them. So let's start with the Essential Vaginal Wand, the V wand. So this one has the pointy trigger point end. And then I went to Pelvic Therapies and I said, can we design a nice soft rounder end? Because really the main reason is because this one kind of made my patients go, no way, I'm not going to even let that near my vagina. And this one, they're like, okay, maybe. So even if this sort of starts you on your journey, this end can certainly treat a lot of trigger points very effectively. And then you can progress to this one if you had really hardcore tight muscles. Please refer to the videos already out there how to use these. The surprise use of the V wand that I discovered when working with my patients is how well it releases myofascial and visceral tightness in the abdomen and pelvic regions. First, of course, I always recommend that you talk with your pelvic floor physical therapist. Get them to show you how they feel it's best used for your gut region, and then you can use a V wand for your home program. Again, this teardrop end is great for releasing tight muscles in your abdomen, as well as adhesions and scar tissue you may have from various things like C-section scars, gallbladder scars, appendix scars, laparoscopies, and just even from endometriosis. This area of the body is so important to release because tight abdominals and scar tissue can really bind down your ribs and diaphragm, so it's difficult to breathe in and then exhale for that diaphragmatic breathing to help bring oxygen to your body and to help heal muscles. Just to give you a better visual of how important that tight fascia in the abdominal region is, if you can see these abdominal muscles and fascia, how they come up along the ribs and they can hold them down and bind them down, and the diaphragm, if you have any adhesions or tightness in the diaphragm, it'll also bind the ribs down. Here is a good visual of the iliacus muscle and the psoas muscle. If your therapist is releasing those, you can then use your V wand, the soft round end, to release these muscles as well. The V wand is great for mobilizing your colon when you have constipation, and pain patients have a lot of constipation, usually either because of the pain medications they're on or their anus is so tight they can't have bowel movements. Either way, go to your pelvic floor physical therapist, get them to show you how they feel is best to mobilize your colon for constipation. And then when you go home, you'll have the V wand to use instead of your fingertips. All right, before I lie down and show you how I would have my patients do mobilization of their colon, let me give you a visual of what's going on in your body. So in your body, if you're laying down and someone's looking into your belly, this is what you see. You're going to see on your left side is going to be your sigmoid colon, and that is actually where it goes out, the anus and the rectum. And then over here is going to be your appendix and your cecum, and the ascending colon, the transverse colon, and the descending colon. And I will show you how I massage that when I lie down. I wanted you to really see where the aorta is, right in the center, so you just want to skip that region when you're doing your mobilization. Let me show you how I tell my patients to do their colon massage using the wand. So I'm showing you standing, but actually I'd be laying down on my back so you can be totally relaxed and your abdominal muscles aren't pulling tight. But I would have my patients go in and first start stimulating the sigmoid colon like I showed you on the poster. And I do at least 4 deep, slow circles. And if you have a lot of hard constipation, then you may have to stay there 6 or 8 times to mobilize it. But if something is painful and it doesn't get better after a few circles, then don't be doing it. Talk to your therapist. Then you're going to go over again to this area in your colon where your appendix is and where the cecum is, where the small intestine comes into the large intestine. And then you're just going to do 4 deep, slow circles or more if you need to. If you do it every day regularly, you're going to want to do it at night before you go to bed because your colon is supposed to work while you sleep. So you don't have to worry about it during the day. So then you're going to work your way up, and each spot that feels tight in your colon, you do 4 slow, deep, keep doing your deep breaths, but 4 slow, deep circles. And then up under your rib here, this is where your liver is and your gallbladder. So again, be slow and careful as long as you don't go too deep and you're just listening to your body, and get your therapist to show you. And then you're going to skip the aorta and then come under here. And this tends to be where a lot of stool gets caught, up under this rib cage on the left side. And then you're going to go down the descending colon and again to the sigmoid colon, and you're good. Now when, again, the sigmoid colon actually comes here and is going to go out your rectum. In this region is where you're going to be doing a lot of your scar tissue release from your C-sections. So that can be done as a slow, deep hold for C-sections. Scars or any of your surgical scars around your belly button or your appendix or your gallbladder. This scar tissue, as long as you move slow and sustained pressure and nothing fast, this end is perfect for that release. All right, I think you get the idea. These wands are useful tools for your body when used wisely. So be creative, but please be careful. And even better, get your pelvic floor physical therapist involved. Let them teach you and show you how to be safe. All right, well, be blessed and happy releasing.